Welcome to the latest webinar from Coronis Health. Today, I am very excited to be here with our subject matter expert on analytics, Connor Doyle, and he is going to be speaking about utilizing financial reports and analytics to drive operational change within your practice. So without further ado, I want to introduce you all to Connor. As I said, he is our Director of Analytics at Coronis Health. He began working in the revenue cycle management industry over 20 years ago. He's been in almost every department involved in the revenue cycle management process, from business operations to client relations, but he really works in tandem these days, both with the internal staff and with clients of Coronis to really facilitate problem solving and process improvement by using data and statistics. So he has a very deep understanding of healthcare financials and RCM metrics, allowing him to provide valuable insights for Coronis as a whole and all of our clients. So I hope you all get a lot of interesting new information out of this webinar to help your own practice. So without further ado, Connor, the floor is yours.
Thanks, Teresa. Yeah, appreciate everyone joining. So we can go ahead and get started here. So obviously, Coronis Health, we are a full end-to-end revenue cycle management company with 35 plus years of knowledge and experience, along with 480 plus clients. We handle everything from the revenue cycle, financial analysis and reporting, credentialing, coding, patient software and collection items, along with EMR and PMS practice solutions as well. As Risa had said, I have been working in the industry for quite some time now. I started back in a mailroom, mailing claims before there was electronic submission. I remember doing the 56K modem submissions to Blue Cross. So I have been doing a lot of different aspects within the industry, and where I'm at now has kind of snowballed into becoming the Director of Analytics for Coronis Health. So we're going to go ahead and get started here. And the first thing that we're going to do is have a quick little poll question before we kind of dive into the meat here. So Risa, if you want to go ahead and get that going.
Yep, so for those of you that are here on Zoom, there should be two questions that have popped up on your screen. So here they are. And these are anonymous, so don't worry, this is the truth. We just want to know who we're talking to. So do you currently have KPIs established for your practice? Be honest. And yes, not sure, or no. And then number two, are you currently comfortable reviewing or calculating your own metrics or your KPIs, which are two words that Connor will use interchangeably today. So I see a lot of you answering. I'll just give you another moment to get all your answers in. So just be honest, and then hopefully at the end, you will have a very different answer for both of these by the end of this webinar. All right, we have a mixed bag here. Ready? Last chance. All right, so let me share these results so you can all see them. So we have some people in every bucket.
Yeah, looks like we definitely have a wide array of responses here. So kind of getting started here, we're going to kind of go through what I see as a normal game plan when it comes to using financial reports and analytics, which is obviously the kind of the biggest buzzword right now in healthcare. And I'm going to kind of show you how to create this game plan. But before you can really create that game plan, you have to ensure that you understand what these items mean. And then at the same time, that after you understand it, how do you implement and utilize it? And then from there, once you've gotten to that point, how do you manage it regularly? So we're going to kind of walk through those steps here, and all of these are important facets of each other. You really can't have one without the other. So jumping right along here, we will go into the process. First things first. So like I mentioned, education and information. You have to know or understand what these metrics mean and how they correlate or maybe don't correlate to other metrics. From there, you need to review or identify your current baseline. Do you fully understand where your practice sits? Do you know how to benchmark yourself? Do you know how to track the trends over time when we talk about these metrics? At that point, you've identified your problem areas and you can create your game plan. Then you can implement this plan, and the only way this game plan will continue to work year over year or month over month is to review, revise, and update. So you have to make sure that you set clear goals which can be identified and tracked. You need to make sure that the providers and the staff understand the goals and how they can be achieved, create timelines, and identify milestones within your game plan to ensure that it's utilized and adopted. Like I said, you need to make sure you review, are you hitting your timelines? Are your milestones too aggressive? And then based upon your review, like I said, adapt to these changes. Either improve upon your game plan, modify it, add to it, remove some items, whatever it may be. It's kind of a constant circle that's consistently moving around because you have to continually educate yourself and review what's going on. And then you're almost recreating or tweaking that game plan. So it's almost like a cyclical cycle. I mean, just like the revenue cycle. So moving into the next aspect here, we're going to kind of start with education and information. And when I talk about education and information, I'm talking about understanding your KPIs. Gain that understanding yourself and or for your practice, and then help to educate those around you. I know KPIs and metrics, those words are used very, very often, and they can seem a little bit daunting. People talk about statistics and math equations and calculations and all these different things, but really at the end of the day, you can utilize some very simple calculations or formulas to gather very deep insight into your practice, and then also implement very monumental change into driving revenue to the bottom line for your business. So if you don't understand your metrics or how they work, those future milestones and overall goals on the path to success are always going to seem out of reach. They're always just going to be a little bit too far away. So first things first, KPI overview. How do they work? Why do they matter? How can you use them, and how do you monitor them? So KPIs, what they are. KPIs, or key performance indicators, are basically just a variety of metrics used to evaluate a practice performance. They usually relate to a variety of different facets within the business, and at the end of the day, there usually always some sort of ratio. And this is kind of where statistics comes into play. There are always some sort of measurement where you have a numerator and a denominator. With that being said, there are a lot of organizations such as HBMA, HFMA, MGMA that publish standards or what they call benchmarks relating to what they should be or where you should be from a practice standpoint. I always like to say this kind of right off the bat. You need to be really careful of these. Going back to statistics, you have to imagine that they are gathering this amount of data across a very, very large population. Obviously, you can take certain sample sizes and look at specialties or localities or socioeconomic regions, but at the end of the day, you have to really be careful about always just focusing on something that an organization gives to you. What you really want to focus on is how you're doing internally. And so at the same time, not all metrics are created equal. Some are ordinal level measurements, while others can be interval or ratio level measurements. Some correlate and some don't. So when I talk about an ordinal measurement, that basically means that it's not apples to apples. You can't take this metric or this KPI and compare it to your peers. Think of something like movie ratings. Those are very subjective because they have a lot of variables. Maybe you don't like the movie. Maybe you're not a fan of action movies, so you give it a bad rating. That's a subjective measurement. Although it is quantitative, you cannot take that and apply it across the board to your peers or to other industry organizations. And lastly, when we're looking at these metrics or tracking them, there's some big things to keep in mind. And this happens a lot with data. Causation is not always equal to correlation. Obviously, these metrics do have numbers involved, but sometimes they can fall out of line. So it's not always that, what you think the cause might be is not correlating to this metric. And then lastly, try not to fall into confirmation bias with your numbers. Once you kind of get into the swing of these types of things and you're looking at these numbers and you're understanding it and you're identifying issues, a very common situation that will happen is you will see the same issue occur once again from a metric standpoint. And your first kind of jump to conclusion is to say, well, this is what happened last time. Your best bet is to always approach these with an open mind and come at it as if you have no idea what's going on. Because more often than not, when you go into it with a set idea of why this is happening, you're probably going to miss the actual reason. So now let's jump into KPIs and more of how they work. So like I mentioned earlier, they almost always utilize a very straightforward equation or calculation to determine their value. One big aspect of this is a lot of different softwares, organizations like we talked about, HBMA, HFMA, and so on, and even internal practices or providers or office managers will utilize variations in these formulas. You have to keep this in mind when you're looking at these things, because even the smallest variation in one of these formulas can make an impact on what the end result is. And it doesn't mean it's wrong, it's just different, and that's fine. So the goal of the KPI is to take the variables out of the equation in order to perform evaluations in a quote unquote apples to apples comparison. And these variables can include different things like fee schedules and your payer mix and what your charge volume might be, or how many providers you have, or what your specialty is. So the KPI's goal is to kind of take those variables out, but at the same time, it can't fully or 100% remove those variables. So they're always going to come into play to a certain extent. So how do we use these KPIs? You have to understand what they are first, and you have to benchmark them. And what I mean by benchmark is you need to fully calculate these things out, and I would say do this on a monthly basis so you can track them over time. You can then use them to monitor and identify changes and shifts within your revenue cycle. And my biggest recommendation is just to create a simple Excel workbook to track these trends. If you don't want to use Excel, you can just use a piece of paper and put it in a folder. Like I said, you just need a calculator, which everyone has on their phone. So it's really easy to kind of track this stuff, whether or not you want to use Excel. And then, so how do you benchmark? You have to look at your KPIs for the last few months. Determine your averages and the month-to-month variance, and then find your within normal limits. Too often, what I see happen is you'll see a KPI fluctuate, and it kind of starts this red flag alert, and there's too much effort almost put into that KPI shifting, where if you've established your normal limit, and you know that you're going to have, on average, maybe a 2.5% or a 3% variance month to month, you can feel comfortable. And then from there, if you start to deviate from that norm or that normal limit, you can start to identify and kind of mark it and track it for the next month or two in order to either be proactive or reactive on the solutions that you aim to provide. And then you have to manage them. If you create the game plan, you do all the work and the effort, and you track and you trend these things, you can't let them slip. You've got to raise the red flag at an early enough time so you can proactively catch an issue before what I call that snowball effect, where it becomes so bad because it's kind of a smaller shift month over month over month until you hit the point in time where you actually finally notice it, and it's something is way out of line, and the amount of labor and effort that goes into trying to correct this problem is exponentially higher than it would have been if you could have caught it at day 60 or day 75. And my last thing is always find your catalyst. Always find what is causing this to happen. When I say be reactive, I don't mean be reactive in the sense of go react to the claims and fix them. Be reactive in terms of spot the issue, find the catalyst, fix the catalyst, and then fix the issue. Because if you just focus on fixing the issues on the claim side, it's just going to continue to happen. So that's kind of a brief overview of, what they are and how to use them. What I'm going to get into next is what I kind of call the major players when it comes to the KPIs. And so these major players are going to be DRO, which is days receivable outstanding. There's kind of a variety of nomenclature when it comes to this metric. I know a lot of organizations might use, days in AR or DAR, or another variation of receivable days outstanding. Overall, this is always the same metric to an extent. It pretty much uses the same calculation. And what DRO basically indicates is it provides you a number that on average, this is how many days it takes for your AR to churn or turn over within itself. And so if you have a DRO of 35 days, all that's saying is that on average, it takes 35 days for your claims to go from billed to $0 balance. So obviously, that's not to say that if your DRO is 35, you're not going to have claims in your 60 or 90-day bucket. It's just looking at an average and statistically saying this is how it's going in your AR. The next one is the gross ratio, and this is an ordinal measurement. So like I had mentioned kind of earlier, there's no external comparison to this. You cannot use this to compare yourself to the practice down the street. And if they're doing 45% gross ratio and you're doing 10%, you would have no way of knowing. You could be far outperforming them with a 10% ratio than their 45% ratio. So that's always good to keep in mind. And realistically, this ratio is just simply indicating, on average, for how many, for every dollar you bill out, you expect X amount in payment, or X number of pennies for every dollar. So those are the first two. We'll jump into net collection ratio. I actually prefer to call this an adjudication ratio because I feel like net collection ratio kind of gives an inaccurate depiction of what I believe it aims to do. And what I see this as is this measures or gauges your overall success of adjudicating or allocating money. So basically, for every dollar you bill out, have you put every penny in the right place? So I bill $1 and 35 cents goes to the payment, another 35 cents goes to the adjustment bucket, and then I'm left with 30 cents. That's most likely going to go to the patient responsibility bucket. So I like to look at that as, am I ensuring that I'm tracking these claims over time and I don't have money or miscellaneous money that seems to be quote unquote missing? Another great ratio is the bad debt ratio. Obviously, as most of us might know, the nature of the industry within healthcare, you can pretty much expect, on average, between 2 and 6% of the claims that you bill out, whether it ends up in the patient bucket or for whatever reason just doesn't get paid by the insurance, you can kind of expect that. So this is a great ratio to look at and see how much money are you writing off for unforeseen circumstances. And it's always best to kind of look at this on the insurance side from a gross billing standpoint, and then also on the patient side. Potentially you are moving some of these patient balances over to collection agencies. Even then, look at the amount of money that you're passing along to a collection agency, and you can, easily use this bad debt ratio on the patient side to identify maybe, need gaps on the front end side of the front desk collections, or did you have a change in process in patient registration? So that's a great ratio for something like that. Moving along here, another one that I'm a big fan of is AR percent over 90 days. I always like to look at this by the responsibility bucket. I like to look at how much of my AR on the insurance side is over 90, and then how much of my AR on the patient side is over 90. Ideally, we'd like to see much less on the insurance side than the patient side, but either way, you definitely want to look at it from the bucket standpoint, and then also look at it from a total standpoint. And then we talk about denial ratio or clean claim rate. This one is really tricky. And the reason I say that is because there are so many different variables or facets and formulas that are utilized in calculating this. When I talk about denial ratios or I talk about clean claim rates, I pretty much break it up into 3 different buckets. I like to look at clean claim rate as how many claims did I bill to a clearinghouse and how many made it through. In my mind, that's a clean claim. A clean claim, or like a dirty claim, I guess, would be something with a data entry error or a demographic error or an insurance error, something that is easily correctable or fixable in the front end that may have just gotten missed. So I kind of look at that as that ratio of, was it a clean claim going over there? Where on the flip side, denial ratio is how many remits am I getting denied? How many claims make it to the payer? And then after that point are now being sent back to me and being denied for whatever reason it may be. And there's one last one that I utilize, and it's kind of the combination of these two, and I call it first pass success rate. When you bill a claim out, how many of those are making it through the clearinghouse and through the payer and getting paid on the first attempt? So I do know that these metrics right here are utilized very widely in the industry. My only concern with them is that there's so many different variations in them, and it's never really totally understood of how that's being calculated, that this is one of those metrics that I highly, highly recommend that you calculate yourself. So you can have a full understanding of what is going on and not, kind of be left in the dark of what is this ratio actually telling me. Lastly, we talked about statistics and math and things like that, and at the end of the day, a KPI is simply a ratio, and a ratio is simply a measurement of value, and you should not be afraid to create your own. Although many of these are fairly well known, published, it doesn't mean that you can't utilize or tweak them to better suit your internal processes and better be prepared on a monthly basis to review these. So if you know of certain factors or certain items that are going on, don't be afraid to kind of take those out, put them back in, and utilize your own ratios. I mean, benchmarks in the industry organizations are great, but you have to really truly understand how you're doing internally instead of almost always focusing on, what's someone doing down the street. So as long as you maintain consistent timeframes and sample sizes and you're looking at it apples to apples with your own ratios, you're going to be okay with that. Like I said, think about statistics. And then, think about a ratio that you want to track trends regarding the rate of adjustments compared to your fee schedule every year if you change your fee schedule in January. And you just want to make sure that, that ratio is kind of trending along how it has in the past years, and just making sure that your fee schedule increases every year are going correctly. Or perhaps you want to see like how your payer mix or your patient mix, the balances shift in deductible season. And so you want to look at, how much patient responsibility did I get compared to billing during these 3 months of 21 compared to 20 compared to 19. I can guarantee you it's going up. But, those are different things that it's not necessarily a published KPI, but you can create your own KPIs to look at those different things. So moving on from kind of this benchmarking and tracking standpoint, let's jump right into some of the calculations. And so once again, like I said, DRO, days receivable outstanding, I think it's probably the most common utilized KPI in the industry. I personally like to look at DRO from a total DRO standpoint, and then an insurance DRO standpoint. And why would that be? In my mind, getting insurance claims paid has a little bit more control than getting patient statements or patient balances paid. You can do more due diligence or work on the front end to follow up these claims and get them adjudicated, compared to, obviously there's a lot of laws and stipulations and regulations involved with tracking down and getting patients to pay. So you don't have quite as much control. So I think it's good to kind of look at these in separate aspects. And let's jump to the calculation method. In my mind, I feel like a lot of blogs and websites and things like that tend to overcomplicate this formula. It's really, really straightforward and simple. It's just your total accounts receivable divided by your your daily monthly charges. So all you do is find your average monthly charges, divide that by 30. and then that's your daily average charge, and then just take that number and divide it into your total accounts receivable. And that's going to give you your total DRO. You'll notice to the right there, I say you can use different AR values for different metrics. And what I mean by that is pretty much what I mentioned above. Don't be afraid to simply look at, here's my insurance accounts receivable divided by my average or my daily monthly charge. Or maybe you want to look at your DRO by financial class. Feel free to do that. Most, if not all, systems allow you to run a charge and payment report with a ending balance on it. And you can take that and look at the DROs between your different payers. So like I said, find your average monthly charge amount. Pretty straightforward. I always highly recommend using a 90-day time frame. That doesn't mean you can't use 180 or 6 months or even a year. Just divide that by 30. That's your average daily charge amount. And then divide your current total AR, like I say here, insurance AR, by that amount to calculate that DRO. One thing that I will say here, and I kind of mentioned this earlier, is I choose to use 30. I think there's 30.215 days per month on average in a year, so I choose to round down. There are some platforms or organizations that use 31. And just by shifting that from 31 to 30 or vice versa, you're going to get different results. So that's, once again, why it's important to know how these are being calculated so you can, accurately define these different metrics. And this is another one, like I had said earlier, when I said, I highly recommend that you calculate your own denial rate or clean claim rate or whatever you want to call it on your own, so you know what you're putting into that formula. I think it's really important to become comfortable calculating DRO on your own as well. I'm not a huge fan of letting systems kind of spit it out at me. I think it's such an easy equation that it's more worthwhile to understand the DRO calculation, and mainly because DRO is such a determining factor in these KPIs, and it can be used in such a widespread fashion to drive some of this operational change that we're going to start talking about. So right here, just a quick sample of the calculation. We have Clinic A over here, and the total charges for May through July was 1.424 million. I'm just going to divide that by 3, get my average, divide that by 30, get my daily. Right down here, we see our current total AR and current insurance AR, and I'm just going to divide that number into it. And then those are the numbers that we get at the bottom, 37.68 on a total basis, and then 27.51 on an insurance basis. And so here's that calculation right here. So like I said, it's really straightforward, and it's really easy to do. So next one I'm going to jump into, which is another very, very easy equation. And this is another one that works really well from a high level to track and trend account performance. Pretty much this ratio and DRO can be utilized to spot almost any sort of issue that might be occurring. And not spot in the sense of identify the problem, but spot in the sense that you are going to know that something is not going correctly, and then take that proactive approach or that reactive approach to fix it and then make sure it doesn't continue to happen. I like to, like I said, track this on an insurance level, patient level, and then a total level. Very simple calculation. AR dollar amount, that's over 90, divided by your total amount. That's your ratio. And so the total AR for Clinic A is 854,000. They have 175,000 over 90. That gives us our 20.5%. So jumping into growth ratio, like I said, this is just simply your payments divided by your total charges over the same period of time. You can use this on a post-date basis or on a data service basis. I like to use it on a data service basis where I can look back, for all of the charges or dates of service in January billed out, what is my growth ratio 4 months after that for the January charges? And it's a great way to track and trend like the reimbursements on a time frame. General rule of thumb, about 90 to 95% of your claims should be cleared up within a 4-month time frame. Like I said, you can't really remove the variables from the fee schedule, from this KPI because of things like a fee schedule. And I did touch on this. A practice with a growth ratio of 85% is not necessarily outperforming a practice with a ratio of 10%. Think about it, one practice could have their fee schedule set at 10 or 15% above Medicare, which at that point, obviously, the reimbursements or the allowed amount compared to the billing amount is going to come in much closer to the fee schedule, where if you're billing things out at 10 times Medicare, it would only be expected that your payments compared to your billing are going to be much lower between the two practices. And so once again, just another sample calculation here. Charges the last 6 months, 1.252, payments, 542,000. You just divide those into each other, and that brings you to your growth ratio. One thing I will say with growth ratio is even though you cannot use it to compare yourself to Dr. John or Dr. Jane down the street, you can use it internally, and it's a great metric to use internally. This is going to be something that you definitely want to track on a monthly basis. You are going to see some fluctuations within it, more so than I would say most KPIs experience, but I highly recommend utilizing that. And then lastly, we're going to get into some of the other formulas here. So net ratio, like I had said before, I called it the adjudication ratio. Also very straightforward. It's just your payments plus your adjustments minus your refunds divided by your total charges. That's going to come out to a number that should be in the high 90s, mid to high 90s. The bad debt ratio, gross billing write-off by total gross billing. So that's kind of when you're looking at how many insurance claims did I have to write off for whatever reason compared to how many claims did I build out. Vice versa, when you look at the patient side of things, you want to look at patient balance write-offs to total patient responsibility and what that was over time. There are some systems, or I would say actually a lot of systems, that do make it somewhat difficult to kind of track or trend like total patient responsibility as a flat or static number. And if that's the case, just go ahead and use total gross billings. But like I mentioned, make sure that you know that's the denominator that you're using for that calculation. And then once again, clean claim rate, total claims rejected divided by total claims submitted. And when I say rejected, I always use that verbiage as something on the front end, something that is going to come back on a 277 edit that, it's more likely than not a data entry error or something on the insurance or the demographic side. And then the denial ratio. I like to look at this on a procedure basis and always kind of make sure that you're not including erroneous denials in this calculation. And when I say erroneous denials, I mean items such as like quality reporting codes, or you submitted a claim and it was inclusive or bundled, so they quote unquote denied one of the procedures, but it's not a true denial. That procedure most likely will not be paid because it's a inclusive item, and so I don't think it's always fair to include those. So just make sure you know what the actual denial reasoning is, and only include the ones that are actually true denials. And then just look at that by the total procedures you've built out. And that's what I kind of consider the denial ratio. So that is kind of the first aspect of our review, education information. We're going to jump here to reviewing your current situation. We're going to stop here for one more quick poll question, and then we can keep moving on.
Great. So I know this has been a ton of information. It's very detailed, but as of this point, do you now feel more comfortable calculating your KPIs after hearing what Connor just went through? So let's see. I know this is a lot of high level information, but like I said, it's being recorded, so you can always go back and kind of relook at some of these slides and the calculations. All right. Get in your last answers here. All right. Well, this is great. Look at this.
I like that. Okay. Cool.
I like that. Yeah. So I'm glad that you guys found that helpful and you now feel more comfortable. Of course, Connor is always available to sidebar for any of our clients or anyone if they would like to speak with. All right.
All righty. So Talking about general benchmarks here. As you may or may have not noticed, I'm not a huge fan of drawing a line in the sand when it comes to benchmarks. In my mind, general rule of thumb, total DRO should be somewhere between 30 and 37. I would say that on average, your insurance DRO should ideally hover around 30. But obviously, payer mix, specialty, demographics, along with other variables will definitely impact this. A practice with a high workers' comp or auto claim volume is more likely than not going to have a DRO than a practice that sees all Blue Cross and Medicare. It just is what it is. Same thing here, AR percent over 90. In my mind, your goal is to only have 20% of that. When I kind of get a little bit more detailed, I would say that of that 20% that's over 90, of that amount over 90, 80% should be on the patient side and 20% should be on the insurance side. So what I mean by that is if you have $100,000 over 90, basically 20,000 of it should be on the insurance side, while 80,000 should be on the patient side. And that kind of correlates right back to why I like to look at insurance DRO, because you have less control over those patients making payments. And that's a big factor. But general rule of thumb, 20% over 90. And then like I had touched on before, there's no clear benchmark for growth ratio. Just make sure you're tracking yourself internally. So some key aspects to keep in mind, which I have kind of touched on a little bit throughout the first few slides. If someone gives you a KPI, make sure you understand their parameters. Sample size. Don't be too narrow or too broad in your time frame. Kind of find a time frame that you like to stick with, whether it's 90 days or 6 months, and keep that static. Don't keep switching it to quote unquote make your KPIs look better or worse. At the same time though, if you're seeing massive fluctuations in your KPIs, look at your sample size. Did something change? What I mean by that is you look at your growth ratio for the month of August and it went down 20%. Well, make sure you look at your charges. Was a provider on vacation for a week or two during that time frame? Well, that's easily going to explain why that ratio either shifts way up or shifts way down based on some of these factors. So that's a really important aspect. And then I mentioned this earlier as well, causation versus correlation and sample/confirmation bias. Don't just assume right away if something changes that it's linked to something else. If DRO just starts shooting way down, don't just say everything's going amazing and everything's great. I mean, that is probably not the case because you shouldn't see such wide fluctuations in a DRO. And then just don't allow the sample size of the data to confirm an idea you already have. Make sure you prove it out. Make sure you identify that something is happening and then go into the process of proving it and why it's happening. So next, we're going to look at identifying your situation and creating that baseline. So we kind of covered earlier how you identify your situation. Now let's look at how do you baseline. And in my mind, especially if it's just starting out, start with a narrower scope. Don't try and track 25 KPIs every single month. It's not going to go well. Start with something DRO, growth ratio, net ratio, and AR percent over 90. And when you do this, review the KPIs as they are today, 3 months ago, 6 months ago, 12 months ago, maybe even 18 months ago. See how they've been trending in the past. Have they stayed static? Have you seen increases over time? Have they gotten better? Familiarize yourself with how they fluctuate so that you can start to create that game plan. And then determine your normal limits. How comfortable are you with certain fluctuations? You know, what is kind of your breaking point, or what is that point where you raise the red flag and get, you know, either staff or others involved to try and figure out the solution. So find your variance and keep tabs on it. And I'm just going to show something really quick here. This is all I mean by tracking and trending. Something just simple as this: month, charges, payments, and then just some of these simple calculations in here. And like I said, you don't have to use a spreadsheet in order to do this. You could easily do it on paper. So once you've reviewed and identified your current situation, now it's time to create this game plan. Create and identify what you want to do with the information. So determine where you want to be in 3, 6, and 12 months. Make sure you set targeted and actionable goals. Identify the timelines and prioritize the most the most important metrics, and then begin that implementation. And this goes back to making sure that you have education and transparency in what's being measured and how it's being measured. You can't expect somebody to hit a goal or a benchmark unless they're aware of the way you determine that benchmark. So when I get right here into the game plan, are the metrics at the level you feel comfortable with? Were some in line, some outside of the norm? Was everything missing the mark you may have hoped for? Write this down. Take notes on these. And kind of, I think taking long tail notes on some of this stuff is a great way, especially when you get into like the 18-month mark. Looking back at, the month of June and having some notes there based upon, hey, I saw this fluctuate and I looked into it and it was simply caused by X, Y, and Z. Those are great things to keep in mind when you're looking at just strictly data. I mean, you don't just have to use quantitative values to utilize this. You can use qualitative items to also come into play and track these things. Then identify the metrics that you want to improve upon versus the ones you'd like to maintain if there are any. That's a huge factor as well. You have to make sure that the ones you're maintaining are staying in line, and then also the ones that you've identified to improve upon that are actually improving. So, expectations. Like I said, always be sure to set realistic and achievable goals. They are given benchmarks, but don't just try to achieve these because a fellow peer or somebody else said, well, that's where you should be. Like I mentioned earlier, if your DRO is at 55 and half of your practice is auto claims, and you know that it takes 45 to 60 days for these to be paid, if you're expecting to have a DRO of 30, it's just not going to happen. It's not attainable. And right there, you've set an unrealistic goal that is basically going to have you chasing your tail trying to figure out why you can't get to that point. So the key to your game plan is understanding the root causes of these metrics and understanding how they work, what drives them. And then once you understand the driving forces behind them, you can identify to either maintain or improve upon them. So that's kind of like an overview of how we can, build out our game plan and set our expectations. So next, we're going to work into the implementation phase. And in the implementation phase, what is your approach going to be and how will you achieve it? Identifying the metrics and creating the game plan is only a piece of your success. You have to make sure that people are on board, it's implemented and tracked. If you spend all of this time, going about researching this stuff, and then you don't actually follow through month over month or quarterly or biannually, it's going to be all for naught. And so when I talk about implementing, I talk about items in kind of two different facets. I think about it from a top-down versus a bottom-up approach. So when you have this action plan, I always like to determine the approach, and I like to use top-down is something I refer to when I'm working towards metric improvement. So I've identified my metrics. I feel as if they're out of line. My DRO is too high, or my percent of AR over 90 is way higher than it should be. From here, you already know that there are claims sitting in those buckets. You already know that there's AR that's aged and that's old. So you're going to take that top-down approach at the back end or the end of the AR. So it's going to be those older claims that you want to focus on. You want to see why they've made it there, how they made it to that 120, that 180, that 365 bucket, and then determine their catalyst. What was the reason behind this happening? You have to fix that, because if you don't fix that part, you're just going to be in the same situation 12 months from now or 18 months from now. So it's always best to fix the issue first and then go back and remedy the claims. Too often I see people just focusing on all the old claims, and they get them all cleared out, they spend a bunch of time, and one of two things happens. They kind of stop paying attention to the current claims, and things start to fall out of line and those start aging, or just the same problem starts happening again. And then from there, there's the bottom-up approach. And I kind of correspond this to either maintenance, or if you have taken a top-down approach on a metric and you see improvement, but then for a couple months, it's starting to deviate the opposite direction, that's when you got to look at the bottom-up approach, because you've already identified your top-down approach. You've already identified the ones that are out there. Something must be going wrong with those current claims that is causing this to start shifting again. And that's actually similar to, you need to make sure that when you're taking these approaches, don't forget about the current stuff. Very often, people will kind of take an approach of focusing on all the old stuff, and things start looking good, but they're not focusing on the new stuff. So you got to go back to the bottom, to the current claims, and make sure you're getting those paid. So, like I said, it just differs due to the fact there's been a change in process or something has gone wrong with current claims. So metrics are staying normalized and improving, something is changing, it's causing it to fluctuate the opposite way. So identify that fluctuation once again, or that catalyst, correct it, and then fix the claims after. Moving on, here's a little bit more detail. So top-down example almost always takes place after you've reviewed and benchmarked. You've determined your DRO is sitting at 50. It's been slowly climbing over the past 12 to 24 months. You'd like to improve it to 30 or 35. In order to determine the root cause, you have to review and examine the older claims. That's what's causing it. And more often than not, it's going to be something pretty straightforward and simple. Those are the catalysts for the increase: identify, fix, and then go to the claims. So prevent the issue from continuing to occur, and then go back and clean up what's left over. And then bottom up. So, like I had mentioned, this takes place when you're maintaining or improvement has started but then begins to slow. You've identified your DROs at 32 days on a consistent basis. You've started to notice an upward trend. The reason I call this bottom up, look at those current claims. There's something going on in that 30 to 60, 60 to 90 day bucket, because if your DRO is usually at 30, most of your claims should be in your 0 to 30 day bucket. So the ones that aren't are going to be in those, 60, maybe 90 day older buckets up to the 120. That's where you want to look, and you want to catch those before you run into issues like timely filing or something like that. And then once you fix the reason why this is happening, like I said, go back and fix the claims. Always fix your problem first. And it's not to say you can't work in tandem to fix the solution and the claims at the same time, but just never overlook the fact of fixing the original issue at the front end. So now we will move into reviewing, revising, and updating. We're going to have one more quick poll question, and then there's a few more slides, and we'll be finishing up.
Great. All right. So here we go. So do you understand how to use KPIs to take a proactive approach or a reactive approach to processes within your practice? All right, guys, tell the truth. It's okay. I know it's a lot of information, but after going through, I guess, the second part of this webinar, do you now better understand how to use these KPIs to take a proactive or reactive approach to processes within your practice? All right, here we go. Connor, you should be very proud.
Cool. I like to see that. That's great. Okay, so jumping into reviewing progress, revising actions, updating the plan. You've implemented this. You're working on it. You got to make sure you stay the course. I think I've mentioned it numerous times, but you're making progress. You're seeing improvements. Continue to do so. What's going to happen if things get to a point where you're happy with them and then you kind of fall off the wagon a bit? You're going to come back to it in 6 months. Things are going to be outside of the norm. And you've almost got to start this whole process over again, where if you can kind of see these as they happen, you can take quick reactive approaches to why they're happening, solve the issue, and it's not like this whole fire drill all over again. So reviewing, revising, and updating. This part is very similar to the first 4 steps we've talked about. Make sure you re-educate yourself on any new metrics or any items that you may have added or removed from your game plan. It's all about maintenance and adopting or adaptation. Like I said, if you don't track and trend, you're going to have no way to spot the deficiencies to find room for additional improvement upon what you've already improved upon. So utilize the same items from your game plan, maintain your initial goals, or even better yet, aim to improve them. You've hit your realistic goal. Can you take it one step further? You can also begin to identify and implement new metrics. And this is what I talked about of don't be afraid to start looking at other ratios or certain aspects of your practice. it's okay to make up a ratio as long as you know how it works. Just don't forget about the ones you started with, though. Don't get so far along the line that you're kind of leaving the major ones to the wayside. So one thing I always like to say is that when we're aiming to improve on certain metrics, it's not always about just getting every claim paid or finding a concrete solution. Unpaid claims and anomalies are just the nature of the industry. It's unfortunate, but it is what it is. Once again, don't try and allocate labor towards claims that are 24 or 36 months old. Focus on the ones that you know you have a shot at resolving, and that way the ones that may have had a shot at being resolved don't end up like the ones in the 24 or 36 month bucket. So always kind of start, I would say like in that 120, 180 bucket and work your way outwards, because more often than not, anything over 365 days is probably not going to get adjudicated. So unfortunately, your only course of action is just to write these things off. If you have a bunch of claims sitting on your AR from 2015, 2016, and you refuse to write them off, you'll never hit a benchmark that you set for yourself. I mean, those claims are just sitting there and lagging down your metrics, and it's an unrealistic, idea to think I'm going to hit a 35 DRO, but I have 5 years of old claims sitting on my AR. I know it hurts to write these things off, but like I said, it's unfortunately a nature of the industry. So review your 180 to 365, and you're over 365 annually at a minimum, at an absolute minimum. I would say biannually is probably a good time frame, and then make determinations on those claims. Like I said, don't spend a bunch of time trying to get the office visits from 2016 paid. You're going to spend more money and time and effort and labor than you would have actually gotten the reimbursement from that. Obviously, surgeries and higher dollar procedures are a little bit different, but you have to make realistic expectations for these items. So, last couple slides here. Overall items. It's okay to start small. Develop your plan over time. Don't try and build this giant revamp because you're going to get low adoption. It's going to be harder to implement. It's going to be more training. Start small and then just build upon that. The other item that I like to point out is find your cause. If you hear a stampede, think horses, not zebras. More often than not, it's going to be something kind of obvious. And one of the greatest examples, and I would say almost more than 90% of the time, of the AR in your over 90 or over 120 day bucket, maybe even over 180 bucket, I would say almost 90% of the time, 80% of that money is made up by 20% of the patients. So if you have 1,000 patients and $100,000 in your over 90 bucket, I would almost be willing to bet that 200 of those patients make up $80,000. So focus on them first. Fixing one simple, if a patient has a $8,000 balance, fix all their claims at once. Don't just look at dollar amounts by claim and sort it highest to lowest, and then at that point, you're going to be jumping in and out of his account multiple times. Take a strategic approach to it and look for the big picture items. Lastly, stay relevant and high level. You don't have to chase your tail. Like I said, the answer is kind of almost always in the big picture. You shouldn't have to go review 100 counts in detail. You shouldn't have to run a 100-page AR report. Start with the summary and then work your way down. Maybe start with financial class and then pick out, this financial class has the most money in this bucket. Then drill into that financial class. What payer within there is causing this problem? Track your metric and then find for X, solve for X. That's the thing, is understanding how the metrics are calculated. And then once you understand that part, start just looking for the X variable of why it's starting to deviate. And then lastly, just stay mindful. Don't jump to conclusions or allow previous experience to influence the investigation. Approach every shift or every deviation in the metric as if you've never seen it before. The issue you uncovered 6 months ago is probably not going to be the same issue occurring now. It might be, but more often than not, as long as you've followed the procedure and put corrective action in place, hopefully that's not the case. So it's probably going to be a new issue. And that is going to wrap it up here. So questions?
All right, great. If everyone, I know it's almost time, but if everyone can stay on for just a few more minutes, we have a couple great questions to get through. But first, if you wouldn't mind answering these quick questions here, just to help us understand a little bit more about you. So what's your medical specialty? How did you hear about this webinar? And are you a current Coronis Health client? So while you guys are answering that poll really quickly, let's get into the first questions. Let's see. On the denial ratio, if a claim has multiple line items, is it best to base on the total line items on the claim or based on one claim regardless of the number of line items on a claim?
So I think that really is going to depend, and it's going to depend on how comfortable you are with gathering the data or gathering the information out of your system, and are you able to get the line item detail with individual reason codes for it? Do you only just get the whole claim? My recommendation is always going to be look at it by procedure, because if you bill a claim with 6 or 7 procedures on it and only 2 of them get denied, it's not fair to say that whole claim got denied, because 6 out of 8 or 70 or so percent got paid. So I always think it's best to go by procedure, and that kind of comes into play also what I talked about of make sure you know what denials are being considered denials. Was that one line item not paid because it's inclusive or bundled or some other reason? So that's why it's important as well. I think when it comes to that stuff, you have to kind of feel your comfort zone in terms of getting the data and then understanding it, and then just keeping consistent on it. Because from there, you can just track and trend. If it's always 10% because you can't get that detail, then 10% is your metric. How can you improve upon it? I mean, obviously by coding or different things like that, but you can set your own baseline depending on how you want to calculate it, if that makes sense.
Okay, thank you. So a couple of people are asking if the slides will be available for them, and I will say that this whole webinar is recorded, so you can definitely access them through there, and I'll sidebar with Connor and see what else we can do for maybe some of the cheat sheets. So here's a really good question, Connor. How do I compare myself to my peers?
So I think we touched on it a little bit. In my honest professional opinion, your concern should not necessarily be with someone down the street. It should really be following these steps and focusing internally. Understanding where you are and why you're there, and then how you can use this to drive improvement for yourself, I think is the most important factor. There's just so many variables involved when it comes to these calculations that you don't know how they're doing their DRO. Are they pulling out certain AR values? So if someone says to you, hey, I'm doing a 15-day DRO and yours is at 45, you don't know what their payer mix is. It could be all Blue Cross and 95% Blue Cross, and Blue Cross pays in 10 or 12 days or 14 days. So that's great for them. But you have a mixture of letters of attorney or auto or work comp claims. So you can't expect to be at that 15 DRO because your payer mix is different. So that's why I always kind of deviate away from don't compare yourself with the person down the street. Spend your time focusing on yourself internally and how you can improve the processes in your practice.
Okay, great. All right, and last question before I know everyone needs to get back to work. But how often do you recommend going through this workflow, everything you shared today?
So I would say the review aspect, once you've kind of developed your game plan and done all of that, I would say you should review it monthly. I mean, just make sure you're tracking and trending this. And then from there, I think biannually is definitely sufficient. You can get away with annually, but I think it's good to just kind of touch base and look at how things have gone, where you can improve. And it doesn't hurt to spend, an hour or 2 hours every 6 months to look at these things. And when I say monthly, it should only take roughly about 30, 45 minutes to run a couple of reports, plug some numbers in, and you can just track and trend it from there.
Great. All right, thank you so much. So I know we have a mix of people on this webinar. Some are Coronis clients and some are not. But if anyone needs more information or they want to dig into their data a little bit more, what do you recommend they do as a next step?
In terms of in their own practice?
Mm-hmm.
I think first things first is getting comfortable with running a couple simple reports. You know, it's usually fairly straightforward to run a charge and payment report along with an AR report. And that's really, to an extent, all you need for all those metrics we talked about. Once you kind of take that next step, you'll need to run maybe some more detailed reports. But you really just need AR and charges and payments. And, you know, other than that, if you can't tell, I enjoy doing this stuff. So reach out to us, reach out to me, and we're always happy to help.
Yeah, absolutely. I definitely encourage you all to reach out to Connor and Coronis Health. We would love to help you. And we will be sending out the recording and later this week, if not this weekend. So everyone will have access to that. And we definitely look forward to hearing from you if there's anything else we can do to help your practice. So thank you so much, Connor, for your time and sharing all of this, you know, very important financial information that, as much as some of us may not want to know, it's important to know. So we really appreciate you kind of breaking it down for us. And thank you everyone that tuned in and spent a little bit of your day with us. We hope you found this insight valuable and helpful for your practice.
Definitely. Thank you, everybody.
Thanks.